All right, I'm going to show you guys how to put in an NG tube. Please remember that you want to follow your hospital policy, procedures, or your course instructions to make sure that you do this properly. So it's just a little video. What you're going to need, this is a Salem sump tubing. So that's going to be the NG tube that actually goes into our client. And I'm going to use this model here because you can actually see where it goes into the person. You also need some tape to secure it. Some facilities use some water-based lubricant. Make sure that that follows your policy and procedure because you don't want to put anything. Normally this goes into the stomach, but there is that risk that it goes into the lungs, so be very cautious. Then I need some kind of a syringe. This is a 60 syringe. You can also use a 2mm syringe depending on what you have. And I have water. It's going to help it go down into my patient a little bit easier. But again, as long as they have to have a appropriate gag reflex, and they have to be allowed to actually drink in order to do this. So after looking at the order, you want to look at your tubing. So this tubing here has holes. So you would not want to use this when you do tube feeds, because if this is in the stomach and it migrates up just a little bit, you could be putting tube feed and it could be falling down into the trachea. One thing I like to do, I like to look into the nostrils, and I'm looking for that deviated septum, which is where maybe that part of the midline of the nose is off to one side or the other. Also, if maybe they had an NG tube already in one side, you'd want to try to go into the other side if possible, just to prevent skin breakdown. And then looking at this tubing, I like to roll it up in my hands. That kind of helps get it a little more pliable because it is a pretty thick plastic. So I just roll it, and this is giving it just a little bit of a curl, which will help it go into the patient a little easier. When you measure from nose to ear, ear to xiphoid process. That xiphoid process is that bottom part below the rib cage. So you want to make note of where about that is. So some people, like a lot of them will have a number on it. This one doesn't. So I'm just going to use a little piece of tape and mark just past it. So now I know that's about how far I need to go in. So when you start to put this in into the patient, you want to make sure to warn them that this does have to go through that area with the gag reflex. So ideally, they just want to keep swallowing. Again, if you can have them swallow water, if they're allowed, that's great. If not, they can mimic the movement of swallowing. So you want to explain to your patient, this might be a little uncomfortable, just bear with me. I'm going to start to insert it into the patient's nose. And here's where they're going to have to start swallow, 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 swallow. And then once you get it past, sometimes your patients start to move around. They're not super happy with us right now. If you meet a lot of resistance, you need to stop. We're going to keep on going down in. Okay, now if you guys can see, I've got it to the tape. If you follow my tubing all the way down here, it's right in the stomach. This is good for when you're suctioning stuff out of a patient. Now there's a couple ways that you can check placement. If your patient's a wiggler, I would go ahead and tape it. I usually put tape underneath like this and then cross it over their nose. If they're a big sweater, you might need to use a different kind of tape. If it's going to be a long term, there are things called nasal bridles that you can use that actually hold it in, but there are special training that has to be done for that. So when you look at this tubing, you don't ever want to put anything in this blue. It's a vent. You always want to clamp off. So just squeeze this right here if you're going to be opening or closing your suction, just because you don't want any of the gastric juices to come out. You can take out this, make sure you keep this because you're going to need it for suctioning. Some people, and again this can be based on your policy, will go ahead and put about 10 cc's of air in their syringe. Then they're going to open that up. And then they're going to listen for what's called an air bolus. So when I do that, I put my stethoscope right on the stomach, and then I'm going to insert that tin of air. What I'm listening for is a gurgle sound. You'll hear, it might be a gurgle or it might be a little thump, and that's normal and to be expected. Some policies have a person aspirate, so that means you're gonna pull back, and you're gonna get some stomach content. And then after you clamp it, they have that person then put it on a pH card. You put just a little drop to see if the pH is acidic, as the stomach should be. Always remember, it kind of sounds gross, but what you put out, you need to put back in. Unless you're intentionally sucking something out if the person's like impacted with stool. So if I'm just checking placement, if I pull stuff out, I wanna make sure to put it back in so I don't alter the pH. I'm gonna go ahead, before you put anything in this, you need to check placement via chest x-ray. So now that I have it in my patient, I'm gonna go ahead and call x-ray and get them to come. They're gonna verify, make sure that the tubing is at the appropriate location in the stomach before you then connect it up to suction, which I will show you guys in the next video.